I would request everybody to please turn on their cameras. We'll be beginning in a minute. All right, so I think we should begin. Good morning, everybody. This is Palak Kukreja. I'm from the RC Medic Crew. I'm really glad to welcome you all to the volunteer guidance session for this TB support initiative. I'm really glad to see so many of you here today and see everybody coming forward to be a part of this initiative. What makes this more special is that each one of us has chosen to give our time and be there for somebody who may simply just need a little support, encouragement, and somebody to talk to. And I genuinely, truly believe with a little bit of empathy and consistency, we can really create a meaningful impact. To guide us on this process, we have with us Dr. Nitin Mahajan, who brings with him extensive experience in public health and TB care. Dr. Mahajan completed his MBBS from Sion Hospital and MD from Nair Hospital and has been working in public health with the BMC since 2012. He has also served as an epidemic medical officer at Kasturba Hospital, worked with the Ministry of Health and Family Welfare and NCDC in Delhi, and is currently serving as a district TB officer handling the Baikala E ward and Mumbai Central D ward. With his wealth of experience, I'm sure today's session will give us the right guidance and understanding to make us these conversations meaningful for our patients. So, without further ado, I'd like to warmly welcome Dr. Nitin Mahajan and invite him to take over. Thank you so much for being with us, sir. Over to you.
Thank you. Good morning, all. So please share the PowerPoint presentation.
Sir, the file is not being able to open in our devices.
Please. Shall I share the new different file?
Yes, sir, please.
I share the PDF version, so it will be easy to share.
Okay, sir.
Please check. I should just share the PDF version.
Yes, sir.
My video camera is having some issue, which is not opening. So I'll try and again. To start, please let us go on the PowerPoint presentation again. So this is mainly regarding the NTP program, National TB Elimination Program. I'm Dr. Nitin Mahajan. I'm working as a district TB officer for Baikala E ward and Mumbai Central D ward. And we are working under the Mumbai District TB Control Society. It's a society which is made in the Municipal Corporation of Greater Mumbai for TB control, that is implementation of the National TB Elimination Program. So all of you are doctors, so mostly many of you are aware about the tuberculosis. So regarding its incidence, this India contributes more than 25% TB cases of entire world. So we are having the highest burden. TB mortality is also more than 25%, and number of multi-drug TB resistant cases are also highest in India. So our honorable Prime Minister have put up a goal to make India TB free, but it's not very easy. We have to take a lot of efforts, and since 2018, government has taken intensive efforts for TB elimination, but there are some challenges which we have to be addressed. So in India, uh, tuberculosis notification rate is 131 per lakh population. In Mumbai, it's 3 times higher. DRTB cases incidence is also 3.6% in India, but in Mumbai it is 10 times higher. UDST means universal drug sensitivity testing. It is 67% in India. In Mumbai it is more, that's 79%. Success rate is also only 82% in India and 78% in Mumbai. So we just go through the brief of, about the NTP program. So what NTP says, it has kept some objectives. So we have to achieve 90% notification rate for all cases. So out of all TB cases in the community, we have to identify 90% of them, minimum 90% of them to achieve this elimination. Then next goal is to achieve 90% success rate of all new and 85% success rate for all retreatment cases. So to cure each and every patient is a major challenge because in TB, treatment duration is quite long. For drug sensitivity TB, it is up to 6 months to 9 months. For DRTB, it is extending up to 1.5 to 2 years. So that's why patient treatment, other answer, completion of treatment is the major challenge in tuberculosis. To make cure and successful outcome is the major challenge. So we have to achieve 90% success rate for all TB cases and 85% of retreatment cases. Significantly improve the successful outcome of the DRTB cases. So new challenge in tuberculosis is the drug-resistant tuberculosis. Most of you heard about this. What is DRTB? It means many bacteria, TB bacteria develop the drug resistant to single drug or multiple drugs. So that is a major challenge. Whenever there is drug resistance there, we have to shift out to the other drugs. And this the new regimen makes some impact on the successful outcome. So we have to challenge that to significantly improve the DRTB outcomes. To achieve decreased morbidity and mortality of HIV-associated TB. HIV is the major comorbidity which associated with tuberculosis. All HIV patients, many of them have got TB episodes during their life. So we have to decrease morbidity and mortality of the HIV-associated TB to improve outcome of TB patients in the private sector. So in Mumbai, we are seeing that almost 50% of patients are being diagnosed by the private sector. So we have to take coordination with the private sector. We have to register all these cases. We have to follow up all these cases, and we have to do many things regarding proper treatment regimen, everything about the statistics, and we have to capture all data regarding this private cases, which is a major challenge for the public health sector in metro cities. So one program is working in these sectors. So basic of tuberculosis, it's a communicable disease caused by the Mycobacterium tuberculosis bacteria. It's transmitted by air. Main organ is the lungs, and we are giving BCG vaccination at the time of birth to prevent this tuberculosis. But vaccination is not that much effective. It's just giving the partial immunity. Major symptoms of TB, you all know that major symptoms are cough, which is more than 2 weeks, fever more than 2 weeks, blood in cough, loss of weight is the prominent symptom, evening rise of fever, night sweats, and any abnormality in chest X-ray. So these 5 are major symptoms which, by the help of which we can identify the TB cases. And in children, we have to look for the no weight gain in 3 months because in children, all the symptoms are not that much effective. We have to monitor the growth chart, that is weight gain symptom, that will indicate the tuberculosis. So with all these facts, we can know that anyone who prays is at risk of TB. TB is transmitted by air. That is a major challenge to prevent this infection. But major advantage is that TB is curable. So we can cure each and every patient of tuberculosis. So this is the way of transmission. You can see this pink color guy is a TB patient who is transmitting his bacteria into the air through his signs of cough. Whenever the bacteria comes out, another normal individual who is nearby the patient can inhale that bacteria and got tuberculosis. So drug sensitive TB and drug resistant TB. For both of these infections, the mode of transmission is the same. If the bacteria is drug resistant, the patient can directly spread that drug resistant bacteria to the normal individual. So that much is the risk of to the normal individual. Any TB patient who is not taking treatment can infect more than 15 new people in a year. If we not treat the patient on time, cannot diagnose on time, so that patient can infect about 15% in a year. So this is the chain of transmission. We have to prevent that. For this, we have to do early identification of the patient and start treatment on as early as possible. So which are the major factors responsible for TB infection? So we all know that this TB is transmitted by air, but every individual getting infection with the tuberculosis. So which are the people who are at more risk of TB infection? So these category patients are having the highest chances of getting TB infection. So whenever TB catches us, we have to find out some reason within our body. So that is main reason is the lowered immunity. So lower immunity is the main reason. So immunity can be decreased because of many things. So we have to find out that reason among that patient. So major, I already told that major comorbidities associated with tuberculosis is main is the HIV. Whenever there's a HIV patient, his immunity is gradually drops down. So HIV patients are at highest risk of getting tuberculosis. Another major challenge is diabetes. So India is now the capital of diabetes patients, and pre-diabetic category is there, which is attracting this TB bacteria and causing increase in the tuberculosis patient. Next, cancer, kidney diseases, which are also contributing to decreasing our immunity. Another important point is malnutrition in children. Not only children, in adolescent also. So both of these age groups, they are having improper dietary habits. They are having the bad habits of taking fast foods and other things, so which are contributing to their decrease in immunity. So this group is also getting infected with the tuberculosis bacteria. For identifying whichever people are not having the good immunity, we have to monitor their weight for height and weight for age. If the weight for height and weight for age is appropriate with that age group or that height, then we can say that the patient, these people are having the good immunity. So this weight monitoring is the most important thing. Over obesity and undernutrition, both are having the this problem of the low immunity. So body mass index is also the important sign which we can monitor. So tuberculosis, it is being classified by three ways. First is the site of organ inward site of disease, that is pulmonary TB and extrapulmonary TB. When the lung is inward, then it is pulmonary TB. Whenever the other organ is inward, it is the extrapulmonary TB. So which are organ inward in the tuberculosis? So any part of the body, any organ can be inward except hair and nail. So TB can infect any part of the body. And nowadays we are seeing that about 35 to 40% patients are having this extrapulmonary TB. So which is also major challenge of elimination in the tuberculosis. This extrapulmonary TB is being hidden. It's been hidden for years. So primary infection, when most of the time patient got in the earlier age, but it's TB extrapulmonary infection which developed whenever the patient's immunity got lowered. So that is a major challenge in this elimination of the tuberculosis. Next. So which are the common extrapulmonary sites? Most common is the lymph nodes. So lymph nodes are present all over body. So major sites are around the neck. So when there is a visible swelling around the neck, it is giving indication that that patient can have tuberculosis. Then next second site is abdominal tuberculosis. Abdominal TB is coming highest incidence because of it is difficult to diagnose because it is inside the abdomen. So there is no visible sign. Then we have to take the help of other investigation like sonography, CT scan, MRI, and on the basis of symptoms, patient can having different symptoms like improper bowel habits, like constipation, and having the continuous abdominal pain, vomiting, everything. So this is very difficult to diagnose abdominal TB. Bone TB, most commonly spine is infected. Brain TB, whenever the brain TB is there, patient can have symptoms like nervous system, like neck stiffness and other involuntary movements or provisioness, everything. So this brain TB, bone TB, then another most common sign is the pleural effusion, collection of fluid inside the pleural cavity. So it is also most common. The newer challenge is the uterine TB, which is one of the reason for the infertility nowadays. So TB is affecting all major organs and causing damage to the people. We can see this site. This is the lymph node TB around the neck. So this is the common presentation. Whenever such signs are there, then we can suspect the tuberculosis. This size of this swelling around the neck can first indicate the this is tuberculosis. This is abdominal TB. Patient can have any kind of symptom. This abdominal TB most commonly affect the ileocecal junction and can perforate the intestine and can present in a different kind of abdominal symptoms. Next. So all with the help of all this knowledge, we have to now think about the tuberculosis. So what are the important points? That coughing of blood, positive skin test, weight loss, weakness, loss of appetite, malaise, night sweats, everything. So any individual can get tuberculosis at any stage of life. No one can say that I am be strong, I cannot get tuberculosis. No one is there in the world. So everyone can get tuberculosis. So depending on the diagnostic tests, which are the classification, one is the microbiologically confirmed tuberculosis, second is the clinically diagnosed. So this type of classification is most important because we are now dealing with the drug resistant tuberculosis. To get the drug resistant, first we need to identify the TB bacilli. So whenever there is a tuberculosis patient, we need to identify the bacilli within the patient's body or any sample from the patient. So most common symptom we collect is the sputum. So sputum, we have to do the sputum testing in the phase-wise manner. First test will be the CBNAT. Nowadays we are not doing the sputum microscopy testing, which was earlier it was the diagnostic testing, but nowadays we have shifted to the NAT testing, nucleic acid amplification test. It is an advanced test which is utilized in the automated machine, that is a gene expert machine. With the help of that technique, we are identify the DNA of the bacteria. So that DNA will identification will give us the TB presence of TB bacteria, and simultaneously we are getting one drug resistance status, that is rifampicin resistant. So this gene expert machine is giving the two results at a time, that is identification of bacilli and resistance to the rifampicin. So this test takes only 1.5 to 2 hours to give these results. And now in Mumbai, we are doing this on a same day or next day. So whenever we are getting the sample, by the evening of next day, the result will be dispatched to the concerned health facility. So this bacterial identification is the most important, because whenever the bacteria is identified, then only we can do the drug sensitivity testing. What is drug sensitivity testing? That drug sensitivity testing will give the resistance pattern to the all available TB drugs. So ideally there are 14 to 15 TB drugs. We have to test each bacilli for presence of drug resistant to these 15 drugs. So first resistance is important, which is we are getting with the help of NAT test, that is rifampicin resistance. When there is a rifampicin resistance there or bacteria is positive, then we subject that sample to the further DST, that will give resistance to isoniazide, then pyrazinamide, ethambutol, levofloxacin, or injectable drugs. So this will help us to give you the guide the line of treatment. So that is the most important test to get the resistance pattern. Then second classification is clinically diagnosed. Whenever there is not a possibility of getting the bacilli positivity, then we diagnose patient as a clinically diagnosed. Any qualified doctor can identify any patient with the tuberculosis with the help of their knowledge and can start the TB treatment. So next, this is the list of investigation which are available for diagnosing extrapulmonary tuberculosis. So let's go through this. Once put the microscopy, we are still doing that for the follow-up sample. Then CPNAT, just I have informed you TB CPNAT. Then FNAC biopsy for the lymph node TB, sonography for abdomen TB, pleural tapping for the draining the pleural fluid, CT scan MRI to diagnose bone TB and abdomen TB, CSF sample to diagnose the brain TB, gastric lavage, especially in the pediatric age group, to get the sample. Bronchoscopy, whenever there is a sample cannot be collected through the patient, then we will do bronchoscopy to get the sample from the bronchioles. Chest X-ray, which is a screening test. With the help of chest X-ray, we can suspect the tuberculosis and we go further. Blood CSR is not diagnostic but can indicate the patient is having the suspected tuberculosis. Pantox is also not confirming but gives some hints. IGRA, that is test for identifying TB infection. So this is the list of tests which are available for diagnosing tuberculosis. But keep in one thing in your mind, that blood testing is not cannot give the confirmatory TB diagnosis. Whenever we have to diagnose the tuberculosis, we need to have the specific sample, and we know that sample should be from the site of disease, that is either lung or from the somewhere at the biopsy site or somewhere other part. Just I'm getting got one important part. Sorry, I got important call. So we continue. So these are the investigations which are helpful for diagnostic tuberculosis. In this, just we have to keep in mind that blood testing has a very limited role in diagnosing tuberculosis. We have to do different sets of investigation, and especially to get the sample which is helpful to diagnose tuberculosis. That is mainly the sputum or something from the location of the site. Or other, we have to take the help of all this investigation to diagnose extracellular tuberculosis. Next type is the uh, classification TB as per the sensitivity of drugs, that is drug sensitive TB or drug resistant TB. It is the most important classification. For a Mumbai point of view, you should be have in mind that Mumbai is having the highest burden of drug resistant TB cases, which is more than 12 times higher than the other cases in Maharashtra or India. So we are having the 10 to 12 times higher number of cases of drug resistant TB, and the mode of transmission is very similar to the drug sensitive TB. So if whenever the bacteria is drug resistant, it can infect the normal individual with the help of this drug resistant bacilli. So we have to be very cautious whenever we are working in the Mumbai. So whatever the reasons of multi-drug resistant TBs, if bacteria become resistant to one or more drugs, you have to find the drugs which are effective against that TB bacteria. For that, we need to do the DST testing. DST to the sensitivity pattern to the range of drugs, and accordingly, we have to modify the medicines as per the DST report. This CDST testing is free of cost under the program, but we need to refer the patient for this. In private setup, this cost about 15,000 to 20,000. So what is the main reason to developing the DRTB? The main reasons are patient is not taking regular treatment, patient has stopped the treatment in between, bad dietary habits during the course of treatment, and direct contact with the MDR patients. With this reason, patient can develop the drug resistance pattern in the bacillus. So these are the factors causing obstacles in TB treatment. That is mainly the comorbidity. So HIV, 6 out of 10 patients having TB in their lifetime. Diabetes which lowers the immunity. Diabetes patients have to be screened for TB with any symptom. Control of sugar is most important. Weak lungs, by any lung disease like asthma, cancer, COPD diseases. Why nutrition? Inadequate diet, nutrition is must. Addiction, any kind of addiction that is alcoholic or cigarette, BD, tobacco will make patient to not some blurring blood noise there. So next is presumptive. I have informed that this based on the 5 symptoms we can suspect TB case. But nowadays, for any kind of high risk individuals, we need not have to wait for 2 weeks of any patient of this kind of category. So with the help of 2 days of cough, we can directly refer patient for the testing. So these categories are contrast of microgyric TB patient, PL, HIV, diabetes, mild patient. In this group, we need not have to wait for 2 weeks of cough. We can directly suspect patient with a smaller duration of cough, that is 2 to 3 days of cough is enough to refer the patient for their NAT testing. So which is main test, that is CPNAT. Just go through CPNAT test. Why we are preparing CPNAT test? Because with the sputum microscopy, 30% cases are being missed. This is a cartridge-based nucleic acid amplification test. It's also known as gene expert test. We have different kind of machine, 4 module, 8 module, 16 module. All sample, that is sputum sample and TB sample, both can be tested on CPNAT. It gives result to the TB bacilli presence and also refer resistance pattern. Only 2 hours we need for the blood, and we need trained lab technician for diagnosing this CPNAT. So these are the DRTB regimens. Whenever there is a DRTB cases, we have to formulate the regimen as per their DST report. So there is a group A, group B, group C kind of drugs. So we have to make regimen with this. Any regimen should contain 3 drugs from group A and 2 drugs from group B. But if any side effects or anything is there, then we have to replace that drug with the sequence as per the group C drugs. So this is a regimen making thing, which is nations are preferring. So now we go through the this sample technique. This is a kind of special kind of tubes are available, Falcon tube, to collect the sample. If it is not available, then we collect sample in the sputum container. So nowadays for CPNAT testing, we prefer to collect sample in the Falcon tube. UDST, I already informed that every patient should have been subjected to the UDST. Means we have to do DST of the patient. But keep in mind that for DST, we need to first have identified the bacteria first. So if we cannot find the bacteria, then we cannot do the DST. So our focus should be on the quality sample. If it is sputum sample, then also we have to ensure that that sample is a good quality. That is early morning sample. Patient have to take efforts to give the good quality sputum. So it is mandatory because when quality of sputum is good, then only we can got the bacteria. And if we got the bacteria, then we can do the DST. If we can't get the good sample, then bacteria can be missed, and simultaneously DST will not be available. So that both will affect the proper regimen treatment. So these tests are available in the government, also in private sector is also available. So we are doing the first line LPA test and second line LPA test to identify the resistance pattern. I'm not going in deep of the in detail because our main focus is on the Nikshay Mitra concept. So we are shifted to that part. So there are different regimens of TB. The for drug sensitive TB regimen is from the 6 months to 12 years. For pulmonary TB, it is of 6 months. For extrapulmonary TB, for lymph node abdomen TB, it is 6 to 9 months. And for bone and brain TB, it can extend up to the 12 months. That is up to 1 year. We are doing follow-up testing at the 2 and 6 months by doing the follow-up smear. For DRTB, we have different kind of regimen. That is for 6 months. When the ionization resistance is there, we are preferring the H mono regimen. And if more MDR cases are there, then we refer to the other regimens like shorter regimen, longer regimen, and Bipalin regimen. Bipalin is a new regimen, which is of short duration of 6 months. And we have started this regimen from last 1 year. So just in Mumbai, where these facilities are available for under NTP program, the sputum testing is available at all health posts and dispensary. At these sites, we are collecting the sputum sample and we are having the separate courier system. This sample is being transferred to the lab site. CPRAT test, it is available at all medical college, all peripheral hospitals, and special sites. Special TB hospital clinic, Shivdi Hospital in Mumbai is the special TB hospital, and it is having 4 their clinics inside within the Mumbai. Drug-resistant TB detection and treatment, every ward is having a DRTB clinic at every ward of the Mumbai. TB diagnostic tests are available at all medical college and all peripheral hospitals of Mumbai. TB medicine distribution at all health posts and dispensary, where a dot center. Referral hospital or DRTB at all medical colleges having these are the sites of referring DRTB patient. TB patient admission, any hospital can admit the TB patient, but when it is an open tox case, then they will transfer the patient to the Shivdi hospital. So this kind of extensive network is available within the Mumbai. Just we have to refer the patient as per the patient's need. Now these are the regimen. These are FDC. You should know that now treatment regimen is not like a separate drugs for rifampicin INA. We have been combined all the 4 medicines, that rifampicin, isoniazid, PZA, and ethambutol in a single tablet. That is a fixed dose combination tablet. So we are having 4 FDC for intensive phase and 3 FDC for continuation phase. When a TB regimen is there, we are at 2 phases: intensive for 2 months and continuation phase for 4 months. That is 6 month duration. So 4 FDC is for intensive phase and 3 FDC is for continuation phase. This is the treatment card, which is extensive. We give extensive guideline about the NTP program. We are not going in depth of that card. Second thing, pediatric FDC. You may not see the serum formulation for the anti-TB drugs because these are not available in the serum formulation. So for the pediatric TB, we are having the dispersible tablets. So it's having the appropriate dosage of the pediatric patient, and it is having also 3 FDC pediatric and 2 FDC pediatric. 3 FDC pediatric for intensive phase, 2 FDC pediatric for the continuation phase. So all these medicines are available under the NTP program at each and every facility of the government to supply the medicine. Then this is the DR regimen, which are of very, this is the Vedacudin and Delaminid. There are 2 new drugs which are being made available under the program to treat the drug-resistant TB cases, which are difficult to manage. So these drugs are available at the only at government setup. They are not available in the private chemist. So for any DR case, patient have to approach to reach the respective DRTB site of the ward to get these medicines. This is a table indicating the duration of treatment. I already told you that there are different duration and different regimens are for the TB cases. We will not go through it. This is the main thing, that is a government gazette. So TB is a notifiable disease. Then for that, every health facility, every doctor, every hospital, and every lab, whenever they got the TB case, they have to inform this case to the government. If not, they can be made punishable under these 2 sections, 269 and 270. So with the help of this government gadget, we have made all private setup, all private hospital, doctors, clinics, lab, chemists, everyone to inform TB cases on time. And because of that, we are getting now more than 50% cases of Mumbai from the private sector. They are, or everyone is referring, informing on time about this TB cases. So now we come to our major part, main part of this today's session. I got information from Zuhan madam that she's having a group of students of MBA students which are interested in this Nikshay Mitra initiative. So main concept is for this Nikshay Mitra is that TB Prime Minister TB Mukta Bharat Abhiyan in 2022. Our Honorable Prime Minister have launched this Prime Minister TB Mukta Bharat Abhiyan, and he appeared in every citizen of India to contribute in TB elimination. So anyone who is winning in the campaign is labeled as a Nikshay Mitra. So this Nikshay Mitra can be anyone, any individual or any NGO. We have a list of that. So please go through this. This is any individual, any citizen or anyone can be called a Nikshay Mitra. Any youth group, any student network, any government employee, any cooperative societies, any corporate house, any public health undertakings, any industry, any elective representative, MLA, MPs, urban local bodies, Panchayati Raj, community-based organizations, civil society organizations, self-help group, faith-based organization, religious institution, temple, trust, and charitable organization, political parties, non-government organization, NGOs. So anyone can start contributing in TB process. The main concept is that TB cannot be eliminated with the help of only medical wing. We have to take help from the society because awareness is the main part and main thing is the stigma associated with the tuberculosis. So Nikshay Mitra initiative was launched under the TB Mukta Bharat Abhiyan to strengthen the community participation in TB care and support. It is launched on 9th September 2022 by the Honorable President of India and called for a Jana Bhagidari, that is people's participation. Main target is to mobilize citizens and institutions as a partner in care to provide nutritional, psychosocial, and social support to TB patients and their families. And to initiative seeks to improve treatment adherence, continuity of care, and treatment outcome. Also contribute to the stigma reduction and community awareness. So these are the main concept of starting this TB Mukta Bharat Abhiyan. So what Nikshay Mitra can do? So recently these Nikshay Mitra guidelines have been modified just last 6 months ago. So any Nikshay Mitra can give nutritional support to TB patients. Also this Nikshay Mitra can give nutritional support to the family members of TB patient because whenever the TB patient in the family, the entire family is getting affected and TB can transmit to the other family members also. So we have to take care of the nutritional status of the other family members. So it is extended the nutritional support to the family member of the TB patient. And third support is psychosocial support during treatment and post-treatment follow-up. That is mainly concerned with our youth group. That is all of you. So you have to be involved in this psychosocial support. So for nutrition support, what are the steps? First step is anything can contribute their money into this district TB Mukta Bharat Kosh. It is not at started in Mumbai, but directly you can transfer money to there. So from this money, we can give nutrition support to the patient, just like a fundraising. Second thing, procurement by the Nikshay Mitra. Then if any Nikshay Mitra is want to do nutrition help to any patient, then he can procure nutrition bag and directly come to our setup and he can directly give nutrition bag to the TB patient. Third is procurement and distribution by the Nikshay Mitra. So second is nutrition help by the help of NGO. So anyone who has contributed to this nutrition kits, they can appoint any NGO and can distribute bags to the NGO. So recently government has launched a new app, TB Mukta Bharat application. So all of you have to just download this app, TB Mukta Bharat Abhiyan app. So whenever we want to be registered with the Nikshay Mitra, we have to register ourselves in this TB Mukta Bharat Abhiyan app. So we have to give a basic details like your mobile number, email ID, and short address, and then you will get registered in this app. Whenever anyone is registered, then that information comes to the respective district TB officer. Then we go further to allotting patients to you. So we are having the list of patients, and we allot this patient to the one by one to the any all the Nikshay Mitra. So this app will work like that. And whenever you been allotted with the patient, then you have to start with your psychosocial support to that patient. So everything is digitalized. The TB program is completely digitalized program. Our entire data is available on our Nikshay portal, and we have different sets of apps which are helping this program. So this TB Mukta Bharat Abhiyan app, you all have to download this app and you have to all register yourself with this app. I will send the link in the group. So whenever you registered as a Nikshay Mitra in this TB Mukta Bharat Abhiyan app, after details approval, we are allotting the patient to you. Then, when you start the work actual work as a Nikshay Mitra, then certificate of appreciation will be generated in the online system. So this is a format of certificate which is being emailed to you. You can directly got certificate on your email ID when you start actual working as a Nikshay Mitra. So why the psychosocial support is needed? So it is needed in the two steps. One is the during treatment and post-treatment follow-up also. So just understand that why it is more important, because tuberculosis is the disease which is having the profound psychosocial, social, and economic implication for patient and their family. Individuals they are affected, they often experience stigma, anxiety, depression, social isolation, loss of income, and fear of discrimination. And these all symptoms, these all factors are affecting the patient's adherence. Adherence means they are uh, sticking with the treatment part and recovery and long-term well-being. Psychosocial support is therefore a critical component of person-centered TB care under the NTP. So we have to give psychosocial support to each and every patient. We have to be attached with the patient, and this all have to be done with the telephonic calling. Every patient mobile number is available with us. Whenever you register as a Nikshay Mitra, we allot you one or two patient, and then you have to start the telephonic calling and inform that patient you have been elected as a subjected as a within the psychosocial support. Our TB staff we already informed the patient that such type of calling patient will get going to receive. So they will give you entire information. So what is expected during the treatment phase? During acute treatment phase, patients frequently face challenges. Which are the main challenges? Like prolonged medication regimens. So this treatment, TB treatment, is a very lengthy duration treatment from ranging from the 6 months to 2 years. Whenever the DSTP case or that treatment with at least of 6 months. If it is an extrapulmonary case, then treatment can extend for 12 months. And if it is a DRTP case, then treatment extend for 1.5 to 2 years. So to make patient to adhere to this treatment, we have to be repeated counseling of the patient is required. Then ADR, these all TB drugs are having they are strong drugs. They are each TB drug is having different kind of their side effects. So these are affecting the patient, and every patient having somewhat different kind of adverse drug reaction. So we have to consider them regarding this ADR and their acceptability, and if needed, we have to take the treatment for these ADRs. Uncertainty against the outcome. So they have fear that they will be cured or not. If they have fear of death, anything. Such kind of symptoms we have to be tackled on time. We have to give positive support to the patient, and also we have to focus on the nutritional component also. Then these challenges can be compounded by emotional distress. Most of the patients they are not having the mental stability, household stress. Everyone has stress. They have been subject to live in a separate room. They have been separated from the family, reduced to social support. So this all can infect the risk of non-adherence and treatment exposure. So you have to focus all these points. So what is expected from all of you that you have to give emotional reassurance and motivation to sustain the treatment adherence. So this patient, all these patients are having some kind of reason for getting this TB infection. That reason, which is contributing to the decreasing the patient's immunity. Some kind of wrong dietary habit, some kind of addiction may be there, like alcoholism or the smoking or tobacco chewing. So we have to simultaneously focus on this kind of bad habits like addiction, or some patient have diabetes. So in diabetes patient, we have to focus on the blood sugar level. If patient is having the very poor dietary habits, or there's a significant poverty within the family, we have to address all these things in a proper way. We have to give emotional reassurance and motivation to sustain treatment adherence. We have to address the fear, misinformation, stigma, both within the families and communities. If patient is for the pediatric age group, then we have to speak with the parents. If patient is a female, then we have to also speak with there are other family members like husband. So we have to do this all possible ways to give this kind of psychosocial support. Also, we can help them to navigating the health system, attending the scheduled follow-up visits. Most of the patient, when the symptom got reduced, they avoid the doctor's visit. They just continue treatment, but they are not having knowledge that it is very necessary to do follow-up visits to get completely cured with the tuberculosis. Strengthen trust between the patients, communities, and health services. Community and youth in psychosocial engagement complement clinical care by offering regular follow-up, companionship, encouragement, particularly for adolescent, migrants, urban poor, and other vulnerable groups. So keep one thing in mind that all TB patients, they are having a list of problems. They are within their personal behavior, their personal habits, their addiction, or some kind of comorbidity is there. So we have to find out that first and focus on that, and then give regular emotional support or positive attitude, and to make the patient to tackle all this problem and get better with this infection. So what is expected during the post-treatment follow-up? So post-treatment follow-up is also needed because many survivors, they have challenges such as residual physical weakness. Whenever there is DRTB case of having the highest uh, big level of infection, then patient can have residual physical weakness. Patient may face the mental health concern, social reintegration difficulties, fear of relapses, persistent stigma may affect employment opportunities, education, marriage prospects. So in our program, we are following the patient of every 6 months for 2 years. So after treatment completion, we are again calling the patient every 6 months for their regular checkups. We are doing chest X-ray, their symptomatic evaluation, and sputum correction also. So there are chances that patient can get relapse of tuberculosis within a 2 years period. So we have to continue our this psycho support in the post treatment phase also. In that, what we expect that we can help them in social integration and restoration of normal life. We have to mainly focus on that. You are not being communicable. You are not spreading the infection to anyone. So you are just focus on your health, improve your health so that you will not get again the tuberculosis. Address their mental health concern, reducing their anxiety, loss of self-confidence, reinforce positive health practices and resilience among the TB survivors. And we can make this good TB patient like a TB champions or TB vijetas. So some patients are having different kind of approach, so they can be act like a TB champion, which can help the other patients to get cure from the TB infection. So this is the then next slide is the nutrition support part. A nutrition support is the same kind like a psychosocial support, but I just show this the nutrition bag. As a youth group, you can also approach to the different NGOs or different industries and appeal them to be contribute to the TB Mukta Bharat Abhiyan. Right now we are doing this last 2 3 years, and we have got many big industries, many CSR funds, many these political individuals. They are come forward to be as a Nikshay Mitra, and they are giving the nutrition support to the TB patient. So what government has suggested that the nutrition bag should contain the appropriate nutritious diet. So which indicates we should have at least 3 kg of cereals and millets, 1.5 kg of any pulses, 250 gram of vegetable oil or milk powder. So now it is a little bit relaxed, so we can modify this kit as per our local area. Like for India is having the big country, so for Eastern India, Western India, we can take the local food also, food items also. So this is the TB Arogya Sathi app, which is available for all TB patients. It contains everything regarding this patient treatment, patient investigation, also the bit of health facility. So any patient who is on treatment having the Nikshay ID, he can itself log in, get login into this app and got their treatment details themselves. So this TB Arogya Sathi, we ask patient to download this app and follow their treatment with the help of this TB Arogya Sathi app. And also we are having Nikshay Setu app. So that app also covers entire treatment this program part. It contains the training modules. It contains the all the referral facility information and everything about the treatment NTP program. And we can directly do chatting, online chatting also from this app. So with this, I conclude my part. It's time to come together to end the process. I request all of you to be registered as Nikshay Mitra, and you can now ask any questions if you have, so I can answer it.
Hello, sir.
हाँ बोलिए.
Sir, how to counsel the patients regarding social stigma?
Social stigma. Okay. देखो कैसा है टीबी में मेनली थिंग यू हैव टू बी जस्ट फर्स्ट कंफर्टेबल विद द पेशेंट. तो फॉर दैट हम लोग आपको एक या दो ही पेशेंट देंगे. तो हमको पहले पेशेंट से एक फ्रेंडली रिलेशन बनवाना होगा. जैसे पेशेंट को हमारा जो टीबी का स्टाफ रहेगा वो पहले ही उनको इन्फॉर्म करके रखेगा कि आपको ऐसे डॉक्टर के फोन आने वाले हैं जो आपको बेसिक जानकारी पूछेंगे, आपका नाम भी उनको बताया जाएगा फर्स्ट। सो जस्ट फर्स्ट गेट बी फ्रेंडली रिलेशन विद द पेशेंट, जस्ट आप पहले बेसिक क्वेश्चन ही उनको पूछिए। एक आप कंफर्टेबल होने के बाद फिर आपको जाना है उनके मेंटल हेल्थ एस्पेक्ट पे। सो क्योंकि एवरी पेशेंट इज हैविंग दैट डिफिकल्टी, उनको दे आर नॉट मेंटली स्टेबल। कि टीबी का जो डिसीज का ही इम्पैक्ट इतना ज्यादा होता है, तो सोशल स्टिग्मा जनरली होता है। तो फीमेल्स में काफी आपको देखा जाएगा, तो उसमें हम पूछेंगे कि आपको फैमिली सपोर्ट आपको कैसे मिल रहा है, आपसे वो कैसे बात करते हैं, आपको देखने का नजरिया कैसे है आपका, कोई आपको ऐसे दूसरे रूम में कि आपको यानी आपसे कैसे आपसे दूर दूर रहते हैं क्या, वो सब चीजें होने के बाद आपको फैमिली अप्रोच भी इसमें करना पड़ेगा। जो घर का पेन, तो फैमिली का जो मेन इंसान रहेगा, जैसे अभी फैमिली भी स्मॉल फैमिली एंड एक्सटेंड फैमिली है देयर, तो जैसे घर में 10-12 लोग रहेंगे, तो उनका हेड ऑफ द फैमिली से आपको बाद में बात करना पड़ेगा। इमीडिएटली आप इसमें स्टेप बाय स्टेप अप्रोच इज वेरी इंपॉर्टेंट। दैट्स व्हाई वी आर टेकिंग कि आपको महीने में 2 बार तो भी इनको कॉलिंग करना पड़ेगा। फर्स्ट विल डायरेक्टली टॉक विद द पेशेंट, उनसे कंफर्टेबल पहले होना पड़ेगा, उसके बाद ही आपको बाकी सब स्टेप्स, क्योंकि जैसे मैंने बताया कि इन एवरी टीबी केस यू मस्ट गेट सम रीजन, यू हैव टू फाइंड आउट दैट रीजन कि इनको टीबी हुआ क्यों। टीबी होने का एक पर्टिकुलर रीजन रहेगा, वो रीजन आपको फर्स्ट फाइंड आउट करना पड़ेगा, उसके बाद ही आप पेशेंट को इस साइकोसोशल सपोर्ट पे एड्रेस कर सकते हो। सिर्फ स्ट्रेस कैन बी आल्सो रीजन, स्ट्रेस कैन रिड्यूस इम्यूनिटी। सो अगर पेशेंट को कोई कोविड नहीं, उसको ना डायबिटीज है ना उसका फूड इंटेक रॉन्ग है, उसका वेट भी है, वेट फॉर एज, वेट फॉर एज, एवरीथिंग इज एज पर गाइड नॉर्मल है उसका, फिर पेशेंट को टीबी हुआ, सो दैट कैन इंडिकेट द पेशेंट स्ट्रेस लेवल। Patient is having the extreme level of stress, so that can also make him susceptible to tuberculosis. So आपको पहले वो रीजन ढूंढना पड़ेगा कि एग्जैक्टली आपको पूरा पेशेंट का लास्ट 6 मंथ का उसका डाइट शेड्यूल क्या था, वो कितने बजे उठता था, कितने बजे खाता था, क्या खाता था, ब्रेकफास्ट करता था नहीं करता था, लंच कौन से टाइम पे लेता था, फास्ट फूड कितना खाता था, शाम को लंच स्किप करता था कि फास्टिंग रखता था क्या, ये सब पूछना पड़ेगा। नहीं, जब तक आप वो मेन रीजन नहीं फाइंड आउट करेगा ना, उसके उसके अलावा आपका जो काउंसलिंग रहेगा वो will not be effective. So just focus on that. Every patient is having different kind of clinical, different kind of social and this family profile. So हमको प्रोफाइल पे आपको फोकस करना पड़ेगा। फर्स्ट आपको पॉइंट ढूंढना पड़ेगा। अगर डायबिटीज है तो उसका शुगर लेवल आपको लास्ट 1 ईयर का मैच करना पड़ेगा कि उसका डायबिटीज कंट्रोल। मोस्ट ऑफ द डायबिटिक पेशेंट का एक ही रीजन रहेगा कि उसका शुगर अनकंट्रोल हो गया था, और मेनी पेशेंट यू आर वी सीइंग दैट इन प्री डायबिटिक फेज। नाउ प्री डायबिटीज इज अ डिफरेंट काइंड ऑफ डिसीज। प्री डायबिटिक फेज में पहले टीबी उसको होता है, बाद में वो टीबी का मेडिसिन चालू करता है, डायबिटीज का मेडिसिन चालू करता है। इस प्री डायबिटिक इज itself lowering the patient's immunity. So that time patient is catching the TB infection, or TB plus diabetes are diagnosing at the same time. तो ये हमको we have to research in हमको ढूंढना पड़ेगा exactly क्या है। It is a
Yes,
very
sir. Thank you.
challenge for all of you, because ये थोड़ा सा इतना आसान नहीं कि आपने जस्ट मैंने से बोल दिया कि ये 4 चीजें पे आप बात कर दो कि आपको सपोज साइड इफेक्ट में क्या आता है, नॉजिया, वोमिटिंग, एब्डोमिनल पेन, डिस्कम्फर्ट, खाना नहीं जा रहा है, देन टिंगलिंग नमनेस इन द लोअर लिम्ब, एसिनेदाइटिस, थोड़ा सा हेडेक होना। सो ये रैंडमली दैट इज साइड इफेक्ट्स आर देयर, ये आप पूछना, दैट इज द मोस्ट पार्ट। न्यूट्रिशन पे आपको क्या बोलना है पेशेंट को, कि पेशेंट का पहले वेट आपको मॉनिटर करना है, इसका एक्चुअल वेट फॉर एज कितना है, वो कितना कम हुआ है, 5 to 10 kg से उसका वेट कम हुआ है क्या। If there is a significant weight loss, then we have to counsel as per the patient's requirement. अगर पेशेंट का 10 से 15 किलो वेट कम हुआ है तो आपको उनको बताना पड़ेगा कि they have to increase their diet twice and we have to increase the frequency of taking the food. At least दिन में उनको 6 से 8 बार खाना खाना पड़ेगा। That also they should include the nutritious diet, protein rich diet they have to be consumed. और उनको बोलना कि आपको डेली आपको every weekly they have to monitor their weight. In a week there should be a 500 gram weight gain should be there, so that in a month period 2 kg of weight can be gained by the patient. So entire 6 to 9 month period patient can gain 10 to 15 kg of weight. So ये अभी I am informing, मैं आपको बोलना चाहूँगा कि nowadays extra pulmonary cases are there. So in EP cases weight loss will not be significant. So these are the secondary TB cases. Primary focus was there since years back. जैसे हम लोग अभी आज से आप लोग मैं हम आर वर्किंग इन द मेडिकल फील्ड, नर्सिंग स्टाफ इज समथिंग वर्किंग मेडिकल फील्ड, सो वी हैव बीन एक्सपोज्ड एट एनी पॉइंट ऑफ टाइम। बट टीबी सेकेंडरी टीबी होगा वो कुछ सालों के बाद होगा, 5 to 10 years के बाद। सो इन दिस सेकेंडरी टीबी केसेस देयर विल नॉट विजिबल वेट लॉस, but still we have to consider that कि ये आपको इस टाइप का प्राइमरी इन्फेक्शन कभी न कभी हुआ था, तो अभी सेकेंडरी टीबी का ये आपको ये लिम्फ नोड के पैटर्न में बाहर आया है, एब्डोमेन पैटर्न में बाहर आया है, सो आपको आपके इम्यूनिटी पे लाइफ टाइम फोकस रखना पड़ेगा. सो दिस काइंड ऑफ काउंसलिंग, एंड यू आर द बेस्ट वन टू काउंसिल द पेशेंट बिकॉज यू आर द डॉक्टर्स. सो आप ये बहुत अच्छी तरीके से कर सकते हो दैन पैरामेडिकल स्टाफ. Anyone else?
Yes, sir. Thank you.
Please ask. That is good.
Okay, sir. So Shirley is asking whether do you think a follow-up after every 6 months is enough or not?
So this every 6 month follow-up after a treatment completion will be okay. That is not a effect because that ये हम लोग कर रहे हैं to just investigate the patient. 6 months हम patient को बुलाते हैं, उनका symptomatic screening करते हैं, उसका एक्सरे करते हैं और फिर कफ थोड़ा सा भी कफ रहेगा तो उनका हम स्पूटम सैंपल कलेक्ट करते हैं. That is as per the एनटीपी प्रोग्राम. बट इसमें आपको जो हमने पार्ट दिया दैट इज ऑफ साइको सोशल सपोर्ट. इसमें आप जैसे इसका सिंपल कंसेप्ट ये है कि आपको एक फ्रेंड बनाना है. बस आप एक फ्रेंड बनाओगे, उस फ्रेंड से आप ऑनलाइन कनेक्टेड रहोगे. सो अभी ऑनलाइन कनेक्शन करते हैं सोशल मीडिया. सो यू हैव जस्ट टेक द जस्ट पेशेंट का हेल्थ कैसा है, क्या चल रहा है, सब ठीक ठाक है, घर में सब ठीक ठाक है, कुछ हेल्थ कंडीशन आपका कुछ चेंज हुआ है क्या, इसमें आपको पूछना है. Ensure that कि पेशेंट का जो हेल्थ प्रोफाइल है इट शुड बी कंटिन्यूअसली इंप्रूविंग. जैसे हम देखते हैं कि हमारे किसी बैचमेट को ट्यूबरकुलोसिस हो जाता है तो वो एज अ डॉक्टर वो अपना वेट कांस्टेंट रखता है, खाने पे पूरा फोकस रखता है, बैड हैबिट्स को कंप्लीटली अवॉइड करता है. सो ये सब चीजें एज अ डॉक्टर हम लोग कर सकते हैं. तो ये सब चीज सेम पेशेंट ने भी करनी चाहिए. जैसे कोई अल्कोहलिक पेशेंट रहेगा तो वो टेम्पररी ट्रीटमेंट के दौरान वो ड्रिंकिंग बंद कर देगा, लेकिन जैसे वो क्योर्ड हो जाएगा उसके दिमाग में अब तो मैं ठीक हो गया तो ड्रिंक करने में क्या प्रॉब्लम है, वापस ड्रिंकिंग चालू कर देगा, फिर स्टेप बाय स्टेप ड्रिंकिंग बढ़ते जाएगा. सो ये हमको नहीं चाहिए. सो दैट इज रिक्वायर्ड फॉर द पोस्ट ट्रीटमेंट फॉलोअप. उसके बाद आपको पूछने अरे आप तो ड्रिंक तो बंद ही है ना, आपका चालू तो नहीं किया ना, कुछ कोई पीयर प्रेशर है क्या आपको. सो इस टाइप में आपको एक मंथ ही आपको पेशेंट जैसे फ्रेंडली उनसे रहना है हमेशा. बाकी ऐसा नहीं कि आप डॉक्टर हो, आप एक गवर्नमेंट का काम कर रहे हो, ये हमको नहीं दिखाना है. हमको जस्ट देखिए हमने आपसे फ्रेंडली रिलेशन करना है कि जस्ट ये हम सोशल वर्क कर रहे हैं, इस टाइप में आपको जाना है. एज अ वर्क आप दिखाओगे ना तो उसको आपको आउटपुट नहीं मिलेगा अच्छे से. यू हैव टू डेवलप स्किल्स कि आपको कैसे इसको हैंडल करना है, कैसे इनिशिएट कैसे बात करना है, फिर कैसे हैंडल करना है. सो देयर आर फीमेल पेशेंट्स, पीडियाट्रिक पेशेंट, ओल्ड एज पेशेंट, यंग एडल्ट पेशेंट. सो आप आपकी चॉइस दीजिए, उसके हिसाब से हम आपको पेशेंट अलॉट करेंगे. आपको सब लेडीज रहेगी तो हम फीमेल पेशेंट देंगे उनको. जो ओल्ड एज वाले अच्छे से बात कर सकता है तो ओल्ड एज वाले पेशेंट दे देंगे. तो इट इज योर स्किल टेस्टिंग. अगर आपका चैलेंज क्या रहेगा, हमने आपको जो पेशेंट दे दिया है सो उसका डेथ तो नहीं होना चाहिए, उसका ट्रीटमेंट फेलियर में नहीं जाना चाहिए. अगर फेलियर मींस क्या, उसका बैक्टीरिया पहले पॉजिटिव था, देन बैक्टीरिया नेगेटिव हो गया, एंड आफ्टर 3-4 मंथ्स अगेन बैक्टीरिया पॉजिटिव आ गया, दैट इंडिकेट्स द ट्रीटमेंट फेलियर. और पेशेंट ने ट्रीटमेंट इंटरप्ट नहीं करना चाहिए. तो दैट इज चैलेंजेस फॉर यू कि आपका पेशेंट कंप्लीटली उसने ट्रीटमेंट से अधेरेंस रहना है, उसने ट्रीटमेंट ऑन टाइम पूरा कंप्लीट करना है, उसका जो कोमोर्बिडिटी है वो भी उसका टोटली कंप्लीटली नॉर्मल फेज में चाहिए, और पेशेंट को ट्रीटमेंट सक्सेसफुली कंप्लीट चाहिए, उसका स्पूटम नेगेटिव आना चाहिए, पेशेंट की डेथ तो होनी ही नहीं चाहिए, और पेशेंट के घर में उसके फैमिली में नया टीबी पेशेंट नहीं जनरेट होना चाहिए. सो दीज आर ऑल चैलेंजेस. बोलने के लिए बहुत आसान दिखते हैं बट इट इज वेरी डिफिकल्ट. आपको बहुत रिपीटेड काउंसलिंग होता है, उसके बाद पेशेंट का एक्चुअली बिहेवियर चेंज, हम बीसीसी जो बोलते हैं बिहेवियर चेंज कम्युनिकेशन इन पीएसएम, सो दैट यू हैव टू बी मेड इफेक्टिव इन द पेशेंट्स फैमिली. और पर मैं आपके ग्रुप में शेयर कर दूंगा.
Thank you so much, sir. So we have another question. That should we individualize the approach for every patient?
Yes, yes. First, you have to go through the patient's profile. You can talk with our TB staff also. हमारे TB staff को भी पेशेंट के बारे में काफी जानकारी रहेगी. सो जो पेशेंट आपको अलॉट करेंगे उसके साथ में मैं आपके साथ हमारे TB स्टाफ का भी नंबर शेयर कर लूंगा. आप TB स्टाफ से बात कर सकते हो तो आपको थोड़ा सा आइडिया आ जाएगी कि इस पेशेंट में एग्जैक्टली क्या प्रॉब्लम्स है. उसके बाद यू हैव टू थिंक ऑन दैट कि इस पेशेंट को मुझे कैसे अप्रोच करना है, जस्ट लाइक योर केस स्टडी. पहले आपको तो पेशेंट का जस्ट प्रोफाइल चेक करना है, वो फीमेल है, कौन से एज ग्रुप की है, घर में कितने मेंबर्स है, बस ये सब हमारे निश्चित प्रोफाइल में रहता है। एवरीथिंग इज देयर। पेशेंट का साइट ऑफ डिसीज क्या है, लंग्स है, एक्स्ट्रा पल्मोनरी है, उसको कोमोर्बिडिटी क्या किस चीज की है, उसका कुछ ब्लड रिपोर्ट है वो भी हम शेयर करेंगे आपसे। ये सब पहले यू हैव टू बी फर्स्ट गो थ्रू ऑल दिस एंड देन डिसाइड हाउ यू स्टार्ट द अप्रोच टू द पेशेंट, कि पहले पेशेंट से कैसे बात किया जाए। ये तो नेक्स्ट क्वेश्चन में देखा है कि सर हाउ टू टैकल पेशेंट हु डोंट वांट टू इंटरेक्ट और एज यू सेड दैट दे आर स्ट्रेस सो दे कैन समटाइम्स विल नॉट टॉक नाइसली टू अस, हाउ टू हैंडल दैट। यू हैव टू, जैसे ऐसा कोई पेशेंट रहेगा कि वो आपसे एरोगेंटली बात करता है, रिफ्यूज करता है, देन वी कैन नॉट बी, ये पेशेंट को कुछ स्ट्रिक्ट नहीं है एज पर प्रोग्राम। पेशेंट इज नॉट मैंडेटरी टू इंटरेक्ट विथ यू, जस्ट दिस इज सोशल वर्क। से पेशेंट को कंप्लीट राइट्स है, ही कैन रिफ्यूज द योर अप्रोच, बट ये हम हमारे स्टाफ से इंश्योर करेंगे कि पेशेंट आपसे सही तरीके से बात करेगा। अगर वो रिफ्यूज करता है या उसको नहीं पसंद आता है, सो वी कैन स्विच द पेशेंट टू यू, हम दूसरा पेशेंट आपको दे देंगे। तो पेशेंट पे कोई लीगल बाउंडिंग नहीं है। जैसे हम पेशेंट अगर सपोज ट्रीटमेंट ये भी करता है, स्टॉप भी करता है, सो लीगल वैसे हम उसको कुछ अप्रोच नहीं कर पाते हैं, इस वजह से हम काउंसलिंग भी कर सकते हैं, उनके फैमिली आपको रिपीटेडली विजिट कर सकते हैं। तो आपको कोई रॉन्गली वैसे बात करता है या अपोज करता है, तो देन वी कैन चेंज द पेशेंट। बस पेशेंट को ट्रीटमेंट मेडिसिन देने उसको हमारे पास ही आना है। सो आवर स्टाफ विल मेक श्योर दैट पेशेंट आपसे बात करे, आपसे सही तरीके से बात करे, आपके कॉल अटेंड करे। बट यही मेरा रिक्वेस्ट है कि इसको आप एज अ वर्क प्रोफाइल के हिसाब से मत देखिए, इसको जस्ट लाइक सोशल वर्क एंड फ्रेंडली अप्रोच, एक अच्छे से प्यार से बात करने का। जैसे आपका फर्स्ट इंटरेक्शन इज मोर इम्पोर्टेंट, तो आप पहले पेशेंट का पूरे स्टडी करके उसको कुछ हिडन चीजों पे बात कीजिए, थोड़ा सा टीबी का नॉलेज, जैसे मैंने आज जैसे मैंने आपको टीबी का प्रोग्राम थोड़ा इन शॉर्ट बता दिया। जैसे पेशेंट के टू थिंक दैट कि मोस्ट ऑफ द पेशेंट का, जब हम लोग देखते हैं कि पेशेंट का डीएसटी हुआ ही नहीं रहता है, मोस्ट इंपॉर्टेंट थिंग। टीबी पेशेंट डायग्नोज हो गया है, उसका टीबी बैक्टीरिया अगर हमको मिल जाता है तो इट इज वेरी गुड, बट टीबी बैक्टीरिया मिलने के बाद मोस्ट ऑफ द डॉक्टर्स, प्राइवेट डॉक्टर्स, दे आर नॉट अवेयर दैट कि उनको डीएसटी करना ही है। टीबी बैक्टीरिया आइडेंटिटी इज नॉट द एंड स्टेज। बैक्टीरिया ढूंढ के क्या करेंगे, अगर बैक्टीरिया रेजिस्टेंट ही है तो उसको नॉर्मल मेडिसिन विल नॉट बी इफेक्टिव ऑन दैट, ये हमको समझना होगा। सो ऐसे कुछ हिडन पॉइंट से पेशेंट से बात कीजिए कि आप कौन से डॉक्टर के पास गए थे, कितना लेट हुआ आपको डायग्नोस करना, कुछ तकलीफ सिम्टम कैसे बढ़ते गए, तो ये आपने गलती कर दिया था, तो जल्दी जाना था, ये टीबी हो सकता है, ऐसा जल्दी समझना चाहिए था। जस्ट कैजुअल टॉक इज मोर इम्पोर्टेंट। पेशेंट का टाइम लीजिए कंफर्म कि पेशेंट किस टाइम पे कंफर्टेबल बात करने के लिए, उस तरह से संडे के टाइम पे आप दीजिए, हॉलीडे के टाइम पे दीजिए। आप उनके ड्यूटी टाइम पे कॉल करके तो वो ज्यादा बात नहीं कर पाएगा, इवनिंग टाइम पे बात कर पड़ेगा। Completely it needs your full involvement, your positive approach for this. इससे आपका इनसाइड मोटिवेशन इज मोर इम्पोर्टेंट। करना है करके थोड़ा सा ये इतना इफेक्टिव नहीं होगा। रजिस्ट्रेशन प्रोसेस, जैसे मैंने बोला कि आप सब लोगों ने टीबी मुक्त भारत अभियान जो ऐप है वो आपने डाउनलोड करना है। उस ऐप में जैसे मैंने आपको स्लाइड दिखाया था, उस ऐप में एक स्लाइड है जिसमें आपको देयर आर 4-5 मेंबर्स आर देयर, तो आपको निक्षय मित्र में जाके यू हैव टू रजिस्टर एज अ निक्षय मित्र करना है आपको। निक्षय मित्र करके रजिस्टर करेंगे ना, तो आपका मोबाइल नंबर पे ओटीपी आएगा, तो ओटीपी आपको जब आप इंसर्ट करोगे तो आप रजिस्टर हो जाओगे निक्षय मित्र करके। तो वो डिटेल्स उसमें आपको सिर्फ सिलेक्ट करना है। जब आप रजिस्टर, पहले आपको आपका नाम, मोबाइल नंबर, ईमेल आईडी एंड एड्रेस डालना है, बेसिक थिंग्स। वो आपने डालने के बाद आप एज ए निक्षय मित्र हो जाओगे। आपका यूनिक आईडी जनरेट होगा, निक्षय मित्र आईडी, वो आपको नोट डाउन करना है। देन नेक्स्ट स्टेप में आपको आएगा कि आपको कौन से एरिया में काम करना है, तो उसमें आपको डालना है कि मुझे मुंबई में भायखला, अपना डिस्ट्रिक्ट आता है जे हॉस्पिटल काउंसिलर भायखला। सो हमको मुंबई, महाराष्ट्र में मुंबई के साथ आपको भायखला दिखेगा, तो मुंबई भायखला सेलेक्ट करना है। तो उसके बाद कितना पेशेंट आपको करना है, तो जस्ट यू स्टार्ट विद सिंगल पेशेंट, वन पेशेंट आपको पुट करना है। तो उसके बाद एज अ डीडीओ आप सब डिटेल्स मेरे पास आ जाएगा। देन आई विल मेक श्योर दैट कि आपका वो हम पेशेंट आपको अलॉट कर देंगे। उसके बाद आप पहले हमारे टीबी स्टाफ से बात कीजिए। इफ नीडेड आई कैन टेक अनदर सेशन आल्सो। जैसे अभी तो मुझे यहाँ पे 70 के आसपास कुछ मेंबर्स आज अटेंड किया है, तो आप में से और बाकी जो अटेंड नहीं कर पाए उसको मैसेज आप पास ऑन कीजिए। उसके बाद जितने विलिंग आते हैं हम जैसे एग्जाम्पल के लिए मैं कुछ पेशेंट कैटेगरी आपसे एक्सप्लेन करूंगा कि इस कैटेगरी के कितने पेशेंट हैं, उसमें आप किस वे से आपने अप्रोच करना है, सो दैट विल आई ऑलरेडी I think the notes today is I think 17th August, so we can take a date of 1st September. Next 10 days में आप सब कुछ ये रजिस्टर फॉर्मेट पूरा कर देते हैं। तो आप सबने जैसे आपके हिसाब से आप सब रजिस्टर कीजिए, उसके बाद मेरे लेवल का अप्रूवल लगता है उसके लिए, डीटीओ अप्रूवल, उसके बाद डीटीओ अप्रूव होने के बाद हम पेशेंट का लिस्ट सिलेक्ट करेंगे। Then we will share the mobile number of the patient to you. Also हम पेशेंट को से बात कर देंगे कि आपको ऐसा डॉक्टर्स आपको कॉलिंग करने वाले हैं और आपकी हेल्प के लिए, ये हमारे प्रोग्राम पे हमने नया इनिशिएटिव लिया है, ऐसा करके पेशेंट को हम रेडी करके रखेंगे। फर्स्ट पेज पे रोल क्या सिलेक्ट करना है, इट्स इंडिविजुअल आई थिंक। मैं ओपन करता हूँ निक्षय मित्र ऐप मेरे मोबाइल में, जस्ट वेट। If any query you can ask in a group also, जैसे अभी तो हमारा सेशन खत्म हो जाएगा, उसके बाद आपको कभी भी कुछ क्वेरी रहेगा, so you can just मैं तो ग्रुप में हूँ, आप पूछ सकते हैं। मेरा टीपी का स्टाफ भी ग्रुप में है, इसको क्लिक करेंगे, साइन इन करेंगे, ओके रजिस्ट्रेशन। रोल में आपको इंडिविजुअल डालना है, इंडिविजुअल। अगर आप एनसीसी स्टूडेंट्स हो, मेरे ग्रुप में शेयर करता, अगर आप एनसीसी स्टूडेंट्स हो तो आप एनसीसी सिलेक्ट कर सकते हो, एनएसएस हो तो एनएसएस सिलेक्ट कर सकते हो। अगर आपने माय भारत वॉलंटियर, ये गवर्नमेंट का नया कंसेप्ट है, तो एवरी स्टूडेंट ही कैन रजिस्टर एज अ माय भारत वॉलंटियर। सो आप माय भारत वॉलंटियर बन के आप गवर्नमेंट के किसी भी प्रोग्राम को आप सपोर्ट कर सकते हो एज अ सोशल वर्कर पे। सो आप माय भारत का भी अगर सुख का लॉगिन कर देते हो, उसका भी मैं आपको वेबसाइट शेयर कर देता हूँ ग्रुप में। तो माय भारत वॉलंटियर पे आप लॉगिन हो जाओ, उसका भी आपका एक आईडी बन जाएगा, तो उसमें जाके उसके बाद आपको आप सपोर्ट कर सकते हो। दैट टाइम इंडिविजुअल name of mobile number, email ID, address, password you can select, and state आपको महाराष्ट्र सिलेक्ट करना है। then next step में आपको पूछेंगे महाराष्ट्र में आपको कौन सा रीजन सिलेक्ट करना है, तो मुंबई पेशेंट सिलेक्ट करना है तो वन पेशेंट आप सिलेक्ट कर सकते हो। want to enter in other block ward, अदर ब्लॉक सिलेक्ट करोगे तो मैं आपको पेशेंट अलॉट नहीं कर सकूंगा, क्योंकि मेरे पेशेंट मुझे ही दिखते हैं, सो उनके पेशेंट मैं आपको लिंक नहीं कर सकता हूँ। सो प्लीज प्रेफर भाईकला में पेशेंट खत्म हो जाए तो उसके बाद हम अदर डीटीओ से बात करके, बिकॉज आई एम डीटीओ ऑफ भाईकला। सो अगर आपने ब्लॉक सिलेक्ट कर दिया तो फिर वो निक्षय मित्र ये कंप्लीट डिजिटलाइज प्रोग्राम है, तो जो भाईकला के अंदर जो रजिस्टर्ड पेशेंट है वही मैं आपसे लिंक कर सकता हूँ। मैंने दूसरा पेशेंट आपसे लिंक कर दिया तो उसका जो डिटेल्स हमको आगे डालना है, जैसे आप मंथली जो साइको सपोर्ट देने वाले हो उसका डेट मुझे एंटर करना पड़ेगा कि आपने इस डेट को पेशेंट से कांटेक्ट करके उनसे काउंसलिंग और किया है। सो दैट आई विल एंटर इन, बट इट्स अ कंप्लीट डिजिटलाइज्ड प्रोग्राम। हमारे प्रोग्राम का कुछ भी डॉक्यूमेंटेशन नहीं है, एवरीथिंग इज इन द सॉफ्टवेयर ओनली। ये पूरा कंसेप्ट इज रनिंग ऑन द निक्षय मित्र पोर्टल, निक्षय पोर्टल पे निक्षय मित्र पार्ट जो उसमें सब एंटर हो जाएगा। सो टेक भाईकला ओनली। अगर आपको किसी और एरिया का करना है तो आपको वहां के डीटीओ से भी कांटेक्ट करना पड़ेगा टू गेट दिस एंटायर थिंग वी एंटर ऑन द निक्षय पोर्टल। सपोज यू हैव टू वर्क इन द थाने, तो थाने के डीटीओ से कांटेक्ट करके वो आपको सिलेक्ट करना पड़ेगा, फिर वहां के पेशेंट आपसे अलॉट हो जाएंगे। उसके बाद थाने के पेशेंट का जो डिटेल्स आप दोगे उन डीटीओ को, वो डीटीओ वहां पे एंटर करेंगे। नहीं, आप सिर्फ वहीं पे रुक जाइए भाईकला डिस्ट्रिक्ट पे। आपने देयर आर टू ऑप्शंस कमिंग इन ब्लॉक वार्ड इन भाईकला डिस्ट्रिक्ट, दीस आर द टीयू। से डिस्ट्रिक्ट के अंदर टीयू होता है, सो यू सिलेक्ट एंटायर भाईकला, वहीं पे स्टॉप हो जाइए। इतना वैसे आप अच्छा टीयू नाउ आप टाइम जाओ, उसके अंदर वापस पूछेगा पीएचआई कौन सी, इट इज अ स्टेप बाय स्टेप वी गो टू द प्राइमरी लेवल। सो दिस भाईकला डिस्ट्रिक्ट इज अ सेकेंडरी लेवल, उसके बाद फिर देन अगर प्रेफरल लेवल, देन प्राइमरी लेवल। You select entire भाईकला, so भाईकला कोई पेशेंट आई कैन अलॉट टू यू। निक्षय आईडी, निक्षय मित्र आईडी आपका जनरेट होगा, वो आप नोट डाउन कीजिए। नेक्स्ट स्टेप पे आपको निक्षय मित्र आईडी आप एंटर करेंगे तो आपका फर्स्ट डिटेल्स ऑटोमेटिकली वहां पे आ जाएगा। उसके बाद फिर आप इसको पेशेंट अलॉटमेंट को कर सकते हो। राइट नाउ यू सिलेक्ट ओनली सिंगल पेशेंट, यू स्टार्ट विद द सिंगल पेशेंट। दिस आपको मेन थिंग इज दैट कि आपको पेशेंट का प्रोफाइल स्टडी करना है। तो मैंने बोला कि टीबी पेशेंट या यूनिक पेशेंट, देयर हैज टू बी सम प्रॉब्लम विद इन द पेशेंट, इन द पेशेंट और विद इन द फैमिली। वो आपको फाइंड आउट करके पेशेंट का एक प्रोफाइल सर्च करके आपके दिमाग में स्टोरी बनानी है कि इस पेशेंट को टीबी क्यों हुआ, और इस पेशेंट को मुझे टीबी से पूरा बाहर करना है, टोटली क्योर्ड करना है फॉर लाइफ टाइम, देन हाउ शुड यूर अप्रोच? तो उसमें आपका पेशेंट का एडिक्शन, कोमोर्बिडिटी, पेशेंट का फैमिली बैकग्राउंड, एवरीथिंग यू आर जस्ट आप प्रिपेयर्ड होके ही पेशेंट से बात करना स्टार्ट कीजिए। डायरेक्टली पेशेंट से बात करेंगे तो थोड़ा सा पेशेंट को भी इम्पैक्ट हो सकता है, दैट पेशेंट विल नॉट फील दैट ये उसको जरूरी है या नहीं है। सो नेगेटिविटी आ जाएगी पेशेंट को, बोलते हैं मुझे इसका जरूरत नहीं, मैं तो खुद कर सकता हूँ ऐसा। तो आप इंट्रोड्यूस योरसेल्फ कि आप एग्जैक्टली कौन हो, आप कैसे प्रोग्राम में आपका एंट्री हुआ है, आप क्या करना चाहते हो, एग्जैक्टली क्या है आपका मोटिव क्या है। तो इस टाइप में आपको एक काइंड ऑफ अप्रोच उसको करना है। सो इट इज अ न्यू थिंग, साइकोसोशल सपोर्ट टू द एमबीबीएस स्टूडेंट, ये अभी तक आई थिंक मुंबई में तो स्टार्ट नहीं हुआ है। So JJ College will be the first to do like that. So we expect more and more participation for that. जितना ज़्यादा स्टूडेंट्स आप रजिस्टर करोगे, so it will be like a model. जैसे पेशेंट का ट्रीटमेंट खत्म होने के बाद, जैसे हमने सबको 100% अचीवमेंट कर दिया, जितने पेशेंट में अलॉट कर दिया आपको, तो आप सबके सब पेशेंट आपके क्योर्ड हो गए। So there is zero morbidity, mortality, and 100% success rate. We can say that. So no ward is having the 100% success rate. We are tagging 15% of deficit in the success rate. Right now, every ward is having 85% success rate only. So हम सबको cured करते हैं, so that will make our ward, our district 100% success rate. That is a big achievement. It's a collective effort. So you discuss within yourself also. You are having this in the same phase of previous education. सिर्फ बात कीजिए और थोड़ा सा रीडिंग कीजिए। मैं जो हमारा 2 पीडीएफ डॉक्यूमेंट्स है टीबी मुक्त भारत अभियान का, वो भी ग्रुप में शेयर करता हूँ। दैट इज एक्सटेंसिव डॉक्यूमेंट व्हिच आर प्रिपेयर्ड बाय द मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर। सो उसमें पूरा डिटेल्स है, तो आप अच्छे से उससे गो थ्रू हो जाइए। बेसिक्स ऑफ टीबी का बहुत सारे यूट्यूब पे वीडियोस है, बहुत सारे दीस आर एनजीओज आर देयर, नेशनल इंटरनेशनल एनजीओज, दे हैव बीन मेड मेनी वीडियोस। सो मैंने भी वो यूट्यूब पे डाउनलोड करके मैं पेशेंट से शेयर करता हूँ। तो पेशेंट कैन डू वेरी स्मॉल वीडियोस, 1 मिनट से भी कम टाइम की वीडियोस है। सो वाचिंग दैट वीडियोस विल मेक पेशेंट अंडरस्टैंड द डिसीज इन प्रॉपर वे, they can take proper efforts to get rid of this infection. और कुछ क्वेश्चन? I hope जैसे ग्रुप में तो 200 people are there, so I expect more than 100 Nikshay Mitras from this group. It's a very good thing. Just हमको एक चैलेंज है कि आप एक पेशेंट की जान बचाने वाले हो। इसकी डेथ टीबी से हो गई हमको नहीं पता, बिकॉज टीबी में इंजेक्टेबल मेडिसिन नहीं है। जैसे पेशेंट को क्या लगता है कि मैं ठीक है अभी मैं थोड़ा सा आलसपना कर लूंगा, मेडिसिन नहीं लूंगा प्रॉपरली, बट आगे जाके मेरे पास बहुत सारा पैसा है तो मैं कुछ भी खरीद के खुद को बचा सकता हूँ, या इंजेक्टेबल ट्रीटमेंट, ड्रामेटिक ट्रीटमेंट, हाईएस्ट स्पेशलिस्ट के पास जाके कुछ कर सकता है। ऐसा टीबी में कुछ नहीं है। ऑल मेडिसिन पेशेंट हैव टू टेक थ्रू द ओरल इनटेक ओनली, और दिस इज द राइट टाइम। इस टाइम में पेशेंट ने वो सही तरीके से नहीं किया, देन एट later स्टेज व्हेन पेशेंट बिकम क्रिटिकल, ऐसा ड्रामेटिक ट्रीटमेंट, ड्रामेटिक डॉक्टर कोई नहीं है जो पेशेंट को की जान बचा सके। नो इंजेक्टेबल फॉर्मेट, जो मेडिसिन उसको ही पाउडर करके राइट टू से देना होता है। इससे बेटर है कि राइट टाइम पे राइट प्रोसेस में राइट तरीके से मेडिसिन अभी खा लेंगे तो उनकी जान बचेगी। तो ये सब चीजें जो हिडन इंप्रूवमेंट थिंग्स है कि हमको पता नहीं चलता हमें किसकी जान बचाई, बट इज अ थिंग कि यही सही स्टेज है जहाँ पे पेशेंट को हमारी जरूरत है, और पेशेंट को ये दिखेगा नहीं कि एग्जैक्टली हमने उसने क्या अचीव किया है, बट इट्स देयर इन द हिडन फॉर्मेट कि हमने उसकी जान बचाई होती है। पेशेंट का एजुकेशन जो है वेरी पुअर, उनको कुछ नहीं पता है टीबी के बारे में। उनको पता है ये नॉर्मल मलेरिया टाइफाइड जैसी बीमारी है, बस मुझे हो गई है, दवाई खाना है, ठीक हो जाना है। इट्स नॉट लाइक दैट। जैसे एब्डोमेन टीबी में देयर आर डिफरेंट चैलेंजेस, बिकॉज एब्डोमेन टीबी में पेशेंट का न्यूट्रिशन बढ़ ही नहीं सकता, बिकॉज इट इज हैविंग द एब्डोमिनल सिम्पटम्स। उनका नॉजिया, वोमिटिंग, डाइजेशन प्रोसेस इज बीइंग हैम्पर्ड, इडियोसिंक्रेटिक जंक्शन अफेक्ट हुआ रहता है, पोस्ट टाइम पे ऑपरेट भी करना पड़ता है, परफोरेशंस आर देयर, स्ट्रिक्चर्स आर देयर। इन ऑल सच सिचुएशंस पेशेंट का डाइट हमने कितना भी ट्राई किया इंप्रूव करने के, तो वो इंप्रूव नहीं हो पाता है। दैट इज अ बिग चैलेंज कि इसे पेशेंट कैसे खिलाए और क्या खिलाए। If anyone of you got abdominal tuberculosis of young age female, जैसे 15 to 25 एज की कोई आपको फीमेल हमने अलॉट कर दिया एब्डोमेन टीबी की, तो उस टाइम पे आपका चैलेंज ये रहेगा कि उसको आप कैसे खिलाओगे, क्योंकि एज अ फीमेल उसका डाइट बहुत कम रहेगा, कुछ भी खाने को जाएगी तो वोमिटिंग हो जाएगा, पेट में दर्द चालू हो जाएगा, नोजिया बहुत रहेगा, एवरीथिंग कॉन्स्टिपेशन रहेगा वहाँ पे, वो मेनी सिंपल। बट सो दिस इज द चैलेंज फॉर एब्डोमेन टीबी कि इसको कैसे खिलाए, क्या खिलाए, कितने टाइम खिलाए। what to put for health facility ID. ऐसा तो कुछ नहीं होता है, आप डिस्ट्रिक्ट पे जाके स्टॉप हो जाएंगे. या तो सिलेक्ट जिस पे निश्चय मित्र आईडी जनरेट कर दीजिए आपका. मैं एक काम करता हूँ, छोटा सा वीडियो बना के आपको ग्रुप में पोस्ट कर देता हूँ. आप सिर्फ बाइकला डिस्ट्रिक्ट पे जाके स्टॉप हो जाइए, उसके बाद आपका निश्चय मित्र आईडी जनरेट होगा. देन नेक्स्ट पार्ट में यू हैव टू सिलेक्ट द एरिया. उसमें भी आप भाईकला पे आके स्टॉप हो जाइए कि आपने भाईकला ब्लॉक के एनी पेशेंट यू कैन आर विलिंग टू वर्क. आप पहले ब्लॉक सिलेक्ट कर दीजिए. ब्लॉक में जाओगे तो आप सिर्फ डायरेक्टली भाईकला ब्लॉक पे आके रुक जाएगा, वहीं पे स्टॉप हो जाएगा. देन यू हैव टू सिलेक्ट नंबर ऑफ पेशेंट. उसमें आपको सिर्फ एक सिंगल पेशेंट चॉइस करना है, वहीं पे स्टॉप हो जाना है. तो ऐसा डायरेक्टली आपको आईडी तक नहीं जाना है, हेल्थ फैसिलिटी आईडी तक जाने की जरूरत नहीं है. महाराष्ट्र मुंबई भाईकला बस एंड. उसके बाद नंबर ऑफ पेशेंट 1 पेशेंट ऑफ भाईकला डिस्ट्रिक्ट.
Okay.
आईडी आप
Uh,
कॉल कर लीजिए.
I think you all are stuck at the registration process. So for registration, we will take the questions on the group and we will post some videos also. I think it is overtime and we should not keep Sir waiting for because he is having other works also. So I think we should end the meeting here. Before that, can we take a picture, like all of us?
My video is not working today.
Okay. So whoever can turn on the cameras, please turn on your cameras. Let's have a picture. Palak, can you take a screenshot?
Done.
Done? Okay. So I will open the group for some time and you can post your queries on it. And